I have touched on this topic of cough. Firstly, chronic cough is a cough which is there for longer than 6 weeks. And if you're getting that cough which is unexplained and not settling, I think you need to see a doctor. And your doctor needs to arrange at least a simple chest x-ray. Because people who are smokers, especially middle age and above, there is a chance that the cough could be a depiction of something serious. But again, the cough could be because of infections in the chest. The cough is a very common symptom, and I touched on earlier, if the x-ray is normal, there are only 3 possible causes. One includes the gastroesophageal reflux disease. The second one is allergic condition in the nose, allergic rhinitis. And the third, the commonest cause, is bronchial asthma. Now, bronchial asthma affects a lot of people in the UK, especially children and adults, and children can grow out of it. But cough can be the only symptom. So cough can be benign for benign causes, but could be for serious causes. And I think it's very important, if you are having a cough which is persisting, to see your doctor, and a chest x-ray is very mandatory. They might want a CT scan further after the chest x-ray.